So we've been very fortunate in the chronic lymphocytic leukemia world that over the last few years we've had several novel agents develop which are highly effective for our patients. One of the issues that's arisen, however, is that some of these patients have developed Richter's transformation, a very aggressive form of CLL that can be very challenging to treat. And this has been reported in scattered cases across the different clinical trials, but our effort here at ASCO is to try to put together some of these data from multiple centers across the United States and Australia to try to focus on the characteristics of this patient group as well as some of the outcomes and how they're being treated. So we looked at 9 different academic medical centers in a retrospective review. We were able to identify 71 patients who developed Richter syndrome on novel agents for CLL. This included BTK inhibitors, PI3 kinase inhibitors, and the BCL2 inhibitor venetoclax. In general, these were patients with pretty high-risk CLL. They tended to have some of the high-risk features like deletion 17p in about half of patients, complex karyotype in 3/4 of patients, and about 90% of patients had the unmutated form of the IGHV. And what we found was that these Richter's events tended to occur early, usually within about 9 months of starting on the novel agent. And unfortunately, the outcomes for these patients were poor. So we looked at overall response rate in the range of about 40% for these patients, but a complete remission rate of only 15%, and that was pretty much irrespective of the treatments that were employed. Most patients did receive chemotherapy-based regimens with R-CHOP or R-EPOCH being the most common regimens, and then there were a smattering of other approaches taken, including some of the newer approaches like checkpoint blockade antibodies and other targeted agents. But unfortunately, despite all of these different interventions, the median overall survival for our cohort was only a short 3.3 months. And so we did have 7 patients who achieved complete remission on these different regimens, and none of those patients had actually relapsed within a year of achieving remission, and a couple actually went on to allo transplant. So basically what our summary is that this is a challenging population to treat. We need novel mechanisms of action and new drugs and new approaches. And at the end of my talk today, I'm going to provide a couple of clinical trial programs that are going on right now that I think are very promising for this disease.